The mental health care crisis is escalating. Are psychedelic medicines the solution? It is known that during our tumultuous times of lockdowns and fear, that society's mental health has taken a toll. But few realize just how dire the situation has become when discussing these ailments, which are so often so easily hidden from view. In some respects, the pandemic has accelerated our healthcare crises, the addiction and overdose crisis, the depression crisis, and the anxiety crisis. And these crises can be difficult to see when the illnesses are often hidden by those that experience them, often out of shame or other emotions. But we can't start talking about the solutions to the problem before we know the scope and scale of the problem. How big is this problem? Therefore, in this episode, we're going to be looking at some of the data regarding addiction, depression, and anxiety levels during the pandemic and show you how stark the increase has been. Then, we will pivot to discuss a novel solution which has lots of evidence backing it up, using psychedelics like magic mushrooms and LSD to treat the maladies of the mind. I'm James from the Psychedelic Investor, and if you enjoy this episode, support the channel with your like, subscribe, and hitting that notifications bell. But if you only do one thing to support the channel today, leave me a comment down below. Tell me if you are as terrified by these stats as I am, and if you think that magic mushrooms and other psychedelics could be the solution. Enjoy the episode. Let's start by taking a look at how much addiction and overdoses, depression, and anxiety levels have actually risen since the pandemic began. For addiction, according to the Centers for Disease Control, or the CDC, during the pandemic, 13% of Americans either developed a substance abuse disorder or their current problem escalated. That is more than 1 in 8 people who turn towards drugs to cope with our ever-changing world. These are your neighbors. These are your friends. These are your family. Even more heartbreaking, in 2020, overdose deaths spiked by 30% year over year, bringing the total to 92,000 people in 2020. 92,000 people died from overdose in 2020. That's honestly horrifying. And the CDC data shows that these overdoses increased in every single US state with the exception of South Dakota and New Hampshire. In other words, this is happening everywhere. This isn't a New York problem. This isn't a California problem. This is an American and North American problem, and perhaps even a global problem. Now, addiction and overdoses aren't the only mental health care crises whose rates are rising rapidly. If we take a look at depression and anxiety levels, depending on how we measure, the results can look downright apocalyptic. For example, YouGov conducted a study for the psychedelic medicines company Field Trip Health, which showed that 81% of Americans are showing at least some depressive symptoms. 81% of Americans. Now, it gets even worse. Almost half of the respondents to this survey had enough symptoms reported to be considered as having mild or even severe depression. Almost half. Now, if you think that's as bad as it gets, just wait, because it gets more terrifying. 24% of Americans indicated that they have felt that they would be better off dead, or they thought of injuring themselves in the 2 weeks prior to answering this survey. 1 in 4 people thought of hurting themselves or ending it in the 2 weeks before this survey was taken. Not in their entire life, not in the full year, but in those previous 2 weeks. 1 in 4 people. Sorry, I'm getting a little bit worked up. We're going to move on. So this survey also looked at the coping mechanisms that people were using to combat this rise in depression and anxiety. And this kind of gets us back to our addiction conversation. So 1 in 5 adults reported using alcohol as a coping mechanism during the pandemic. 20% of respondents turned to prescription drugs to cope, and 12% of adults between the ages of 25 and 34 turned to opioids. So these numbers in certain cases are even higher than the ones we just gave, but regardless of which data set we look at, they're horrifying. So another study that was taken actually a few months before this one was in December, looked at the rise of anxiety and depression, and it showed similar, albeit slightly less apocalyptic rises. So according to the Bureau, the US Census Bureau, 42% of Americans experienced symptoms of anxiety and depression, up from only 11% before the pandemic began. This means that the rates of anxiety and depression, or at least people experiencing symptoms of anxiety and depression, almost quadrupled since the pandemic began. More than 2 in 5 people that you meet on the streets in the USA are struggling with depression and anxiety symptoms right now, which again is terrifying. Somebody needs to buy me a thesaurus because I'm running out of words to use. I can't keep saying terrifying and horrifying every time, but whatever. You guys get the point. It's also important to note that often people experience the symptoms of multiple mental health care issues at the same time. So, for example, often people will have depression or anxiety, and then to cope with that, they will end up becoming addicted to substances because they're self-treating themselves. So that's just something you need to keep an eye out for, remain cognizant of. Now, when looking at these studies, we have to be aware of sampling biases. It's true. It is very possible that perhaps these studies are overstating the scale and scope of the problem a little bit. But no matter how we splice this data, no matter how we look at it, we can see there is a clear trend. At a bare minimum, there is a clear trend that society's mental health appears to be worsening. And in fact, it appears like the rate at which it's getting worse is itself accelerating. Therefore, we need to also be accelerating our solutions. Which brings us to the second part of this video, companies working on solutions to our mental health care crises using psychedelic medicines. So for each malady, anxiety, depression, and addiction, we're going to look at one or multiple companies that are working on a solution to the problem. In general, psychedelic medicines work by making you confront the root causes of a mental health condition, which is often rooted in deep-seated trauma. We're going to start with anxiety. So for treating anxiety, the company that is the furthest advanced is MindMed, ticker symbol MNMD on the NASDAQ, and MMED on the NEO exchange. And their solution is using large doses of LSD paired with talk therapy to help combat generalized anxiety disorder, or GAD. The company is set to start phase 2B clinical trials by the end of this year, where they will treat 200 patients with GAD. And though we're going to have to wait until the company finishes this trial and releases their results in order for us to be able to say with any level of certainty that MindMed is successful in treating anxiety, there actually have been studies into whether LSD is useful for treating anxiety in the past. So, for example, in 2014, there was a small clinical trial that was conducted in Switzerland that found that large doses of LSD paired with talk therapy significantly decreased anxiety and fear of death, in 7 of 9 people who had terminal illnesses. And it increased the quality of life in 6 of those 9 patients. So I know, this was a small study, that is true. But between 1950 and the 1970s, before LSD was made illegal, a lot of research was happening on the subject of whether LSD can be an effective mental health care medicine in different diseases, including anxiety. However, the standards that they held in their clinical trials back then don't really meet the standards of our clinical trials today, so we're not really going to get into those right now, and also in the interest of time. There's also a huge amount of anecdotal evidence of people that are dealing with anxiety that have self-treated themselves with LSD, and these people by and large seem to claim that it's worked. So take that for what it's worth. This is anecdotal evidence. Before we can say with any certainty that it works, we need to see clinical evidence. But again, this isn't just 1 or 2 people. There are thousands of people that are claiming this. But the important thing here is, if MindMed can replicate the nearly 78% success rate that was found in the 2014 trial in their 200-patient phase 2B trial. And if this happens, then there may be some hope for people around the world that are suffering from extreme anxiety in the unlikely form of LSD. Now, moving on to the second condition, depression, there's actually a lot more research that is being done right now and in the past couple decades on the ability of psychedelics to treat depression with anxiety. So we have companies like Field Trip and Numinous that are currently using ketamine in clinics across North America. There are companies using DMT, such as Small Pharma, and MindMed is again using LSD. But the company and the compound that is the furthest progressed is Compass Pathways using psilocybin, also known as the active ingredient in magic mushrooms. So Compass Pathways is ticker symbol CMPS on the NASDAQ exchange, and to be clear, there are many companies that are in the early stages of exploring using psilocybin to treat depression, but Compass Pathways is by far the most advanced. They are currently in the process of finishing up their phase 2B trial, testing this, and like with MindMed, Compass's psilocybin treatment will be paired with talk therapy. There is a significant amount of data that shows that psilocybin is extremely effective in treating depression. For example, a study at Johns Hopkins University found that psilocybin treatment was 4 times more effective than the most popular current treatment, a medication known as SSRIs. And a study at the Imperial College of London found that the remission rates were twice as high for patients taking psilocybin as opposed to those taking SSRIs. Due to studies like this, the FDA has actually given psilocybin something called breakthrough status designation, which essentially just allows companies to speed up the testing process. And there's actually a lot more studies done into the ability of psilocybin to treat depression, but in the interest of time, we're going to leave it with those two. We'll probably cover more in the future as they come. Now, in the quest to treat addiction and overdoses, no one company is clearly in the lead when it comes to using psychedelic medicines, nor is any specific psychedelic substance. MindMed plans to start a phase 2A trial treating opioid use disorder with a proprietary drug called 18-MC, which is a non-hallucinogenic form of the extremely hallucinogenic drug ibogaine. Atai Life Sciences, another company, ticker symbol Atai, is planning on using regular ibogaine, and there's actually some solid evidence out there from studies that show that ibogaine may be effective in treating addiction. However, these studies have tended to be very small, sometimes not with the best regimes surrounding the trial, and there aren't that many of them, so it's just too early for us to be able to say with a lot of certainty that ibogaine is the solution. Next up, there is a company called Numinous, which we briefly mentioned earlier. Their ticker symbol is NUMI, and they are using psilocybin for addiction. And this does have some significant data backing it up. For example, one Johns Hopkins University study showed that a year after finishing psilocybin therapy, 67% of nicotine-addicted smokers stayed abstinent. A year after the trial actually ended, which is honestly completely bananas. It's bonkers. No other treatment method for addiction, nicotine addiction, or any other type of addiction has a 67% success rate a year after the medicine stops being delivered. So that is very, very, very bullish on the ability for psilocybin to treat addiction. There are also companies like Entheon that are planning on using DMT, Awaken, which wants to use or is using MDMA. And the reason I'm bringing up all these different companies is, look, I have no idea which one of these companies or which one of these substances is going to end up being the most effective in treating addiction. But data on all of them, although it's still preliminary and early, does seem very positive. So may the best molecule win. For any investors watching this episode, something that I always say is that the most money to be made is in the companies that are solving society's largest problems. And there are few issues that are larger in our society today than the addiction crisis, than the depression crisis, than the anxiety crisis, and just our mental health care crisis in general. If any company can develop a novel way of treating these issues that is much more effective than our current methods, which kind of suck, then not only are they going to make the world a better place, they'll make early investors a killing also. There is a growing pile of evidence that psychedelics like LSD and psilocybin are very effective in healing the mind, although, to be clear, we don't exactly know the mechanisms by which they do this. That's still being researched by scientists, and I don't know which company is going to end up being the winner of this race, and to be clear, nothing in this video is financial advice, but over the next couple of years, as the science develops, I plan to follow this study and bring you guys the updates as they happen. If that is something that you support, leave me a comment down below on whether or not you think that psychedelic medicines really do have as much potential as I believe them to. This is James from the Psychedelic Investor, signing out. I'll see you next time.